The following are the four main roles in GPP guidelines, where pharmacist involvement or supervision is expected by society and the individuals they serve. They are: first, prepare, obtain, store, secure, distribute, administer, dispense, and dispose of medical products. The second is provide effective medication therapy management. The third is maintain and improve professional performance. The fourth is contribute to improve effectiveness of the healthcare system and public health. These roles may vary for each individual pharmacist depending on their practice responsibility. Let's go to see more details. The role 1 covers many pharmacy practice areas, include prepare, obtain, store, secure, distribute, administer, dispense, and dispose of medical product. So there are 5 related functions in role 1. Function A describes prepare extemporaneous medicine preparations and medical products. Pharmacists should ensure that medicine preparation areas are appropriately designed for extemporaneous preparations and are maintained in a manner that minimizes the potential for medication errors and assures the cleanliness and the safety of medical products. Pharmacists should ensure that compounded medicines are consistently prepared to comply with written formulas and quality standards for raw materials, equipment, and the preparation process, including sterility and where are appropriate. Function B describes obtain, store, and secure medicine preparation and medical product. Pharmacists who are responsible for procurement should ensure that the procurement process is transparent, professional, and ethical so as to promote equity and access to ensure accountability to relevant governing and legal entities, and should ensure that procurement is supported by a strong quality assurance principle to assure that substandard, adulterated, unlicensed, and counterfeit medicines are not procured. To ensure that procurement is supported by a reliable information system which provides accurate, timely, and accessible information. Pharmacists should establish contingency plans for shortage of medicines and for purchase in emergencies. To assure that proper storage conditions are provided for all medicines used in the pharmacy or healthcare facility. Function C describes distribute medicine preparations and medical product. Pharmacists should ensure that all medical products, including medicine samples, are handled and distributed in a manner that assures reliability and safety of the medicine supply. Pharmacists should establish an effective distribution system, which includes a written procedure to recall promptly and effectively medical products, with a designated person responsible for recalls. Pharmacists should develop with manufacturers, wholesalers, and government agencies an access plan for uninterrupted supply of essential medicines as a part of a disaster or pandemic preparedness strategy. Pharmacists have a responsibility to be aware of the safety issues of medicines and to institute necessary mechanisms for monitoring occurrence of adverse events. Function D describes administration of medicines, vaccines, and other injectable medicines. Pharmacists should have a role in the preparation and administration of medicines, in establishing procedures in their work setting with respect to the administration and in monitoring the outcome of medication administration. Pharmacists should have an educator, facilitator, and immunizer role, this contributing to the prevention of disease through participation in vaccination programs, by ensuring vaccination coverage, and by also ensuring vaccine safety. Pharmacists should participate in direct observed therapy DOT program in areas such as management of drug addiction, HIV, AIDS, tuberculosis, and sexually transmitted disease, where applicable. Function E describes dispensing of medical product. Pharmacists should ensure that appropriate facilities, trained personnel, standard dispensing practice, and document procedures are in place in the pharmacy for the supply and the dispensing of prescribed medicine and other healthcare products. Pharmacists should access and evaluate all paper or electronic prescriptions received, considering the therapeutic, social, economic, and legal aspect of the prescribed indications before supplying medical product to the patient. Where possible, generic substitution is recommended. Pharmacists should ensure patient confidentiality at the point of dispensing medical product and should provide advice to ensure that the patient receive and understand sufficient written and oral information to derive maximum benefit for the treatment. Function A describes the disposal of medicine preparations and the medical product. Pharmacists should ensure that regular monitoring of the medicine inventory is conducted in the process of periodic inspect for the expiration date and the removal of outdated stock. Pharmacists should ensure that recalled medical products are immediately stored separately for subsequent disposal and prevented from being available for fuller dispense or distribution. Pharmacists should establish a safe way of medicines waste disposal at the hospital and or community pharmacy so that patients and the public can be encouraged to return their expired or unwanted medicine and medical devices. Alternatively, pharmacists should provide appropriate information to patients on how to safely dispose of expired or unwanted medicines. Let's move to Role 2, provide effective medication therapy management. There are 4 functions in Role 2. Function A describes access patient health status and need. That pharmacists should ensure not only medication therapy, but also health management, disease prevention, and healthy lifestyle behavior are incorporated into the patient assessment and the care process. Pharmacists should acknowledge unique patient consideration, such as education level, cultural belief, literacy, native language, and the physical and mental capacity in all individual patient assessment. Function B is managing patient medication therapy. Pharmacists should maintain access to an appropriate evidence base relating to the safe, rational, cost-effective use of medicines, such as reference books on medicine, journal, National Essential Medicine List, and the standard treatment guidelines. Pharmacists should ensure that medicine formulary are linked to the standard treatment guidelines, protocols, and the treatment pathway based on the best available evidence. Pharmacists should have a key role in educating prescribers on the access to and evidence for optimal and appropriate use of medicines, including the required monitoring parameters and the prescribing adjustment. Where appropriate, pharmacists should provide the advice or recommendation to the prescriber or medicine therapy, including the selection of the appropriate medication or dosage. Pharmacists should have access to contribute to use all necessary clinical and patient data to coordinate effective medication therapy management, especially when multi-healthcare practitioners are involved in the patient's medical therapy, and intervene if necessary. Pharmacists should be established a standard operating procedure for referral to physician, specialists, or other healthcare provider where appropriate. Pharmacists should provide continuity of care by transferring information on patient medicine as patient move forward sector of care. Function C describes monitor patient progress and outcome. Pharmacists should consider patient diagnosis and patient-specific need when assessing patient response to medicine, thereby and intervene if necessary. Pharmacists should document necessary clinical and patient data to access and monitor medication therapy and check patient therapeutic outcome. When needed, pharmacists should perform point-of-care testing for patient in order to monitor and adjust therapy. For example, INR, blood sugar, and blood pressure. Function D provide information about medicine and health-related issues. Pharmacists should ensure that in every pharmacy there is a suitable place for discussing confidential information with the customer and the patients. Pharmacists should provide efficient health, disease, and medicine-specific information to patients for their participation in their decision-making process regarding a comprehensive care management plan. This information should aim at supporting adherence to treatment and the empowerment of the patient. Pharmacists should be proactive in reducing antimicrobial resistance by providing information about this appropriateness use of antibiotics to consumers and the prescriber. Hello, fellow pharmacists. It is great to meet you again on the web. The topic of this unit is good pharmacy practice in hospital setting. There are 4 main parts in this unit course. The first part, I will introduce the characteristic of hospital pharmacy practice, include pharmacist's role in medication use process, key component in hospital pharmacy practice, hospital practice standards and guidelines. The second part, I'd like to show you the core element of GPP guidelines, including origin, mission, requirements, frameworks, and steps to establish the guidelines. Then I will describe more detail about four main roles for pharmacists in the guidelines. In the final part, I will give you a real-world example about the development of GPP, the lessons learned from the US. What is institutional pharmacy practice? Hospital pharmacy practice include the provision of distributional and clinical pharmacy services. Typically, the institution that pharmacists serve are linked together into integrated health system. The integrated model creates the potential to provide enhanced level of patient care continuity through access to medical records and patient care providers. The hospital system integrates all care under the umbrella of a central organization and often include inpatient, acute care, primary care, outpatient care, long-term care, and home care. The mission of the hospital is to positively impact health outcomes. In the modern world, there are hospitals in almost every city, each employing pharmacists. Opportunities in institutional pharmacy practice are everywhere. Pharmacist's role in the medication use process. The role of pharmacists is to lead the influence, the safety and the quality of all aspects of the medication use process. This means that pharmacists should be involved in controlling or influencing any steps of the medication use process that can impact patient health outcomes or costs. Therefore, pharmacists have important direct or indirect roles in prescribing, transcribing, dispensing, administration, and monitoring. Prescribing. Prescribing medication is often viewed as something that only physicians are authorized to do. However, the reality is that many other healthcare professionals are authorized to prescribe by law. For example, dentist, nurse practitioner, optometrics, and some others, or through a formalized process in hospital, known as privileging. Privileging is the process by which an oversight body of a healthcare organization or other appropriate provider body, having reviewed an individual healthcare provider's credentials and performance, and found them satisfactory, authorized that individual to perform a specific scope of patient care services within that setting. Pharmacists who have prescribing privileges in hospitals are typically authorized to do so through the formalized privileging process. A more common role for pharmacists beyond actually prescribing is the pharmacist's duty to influence the prescribing of other health professionals. Pharmacists indirectly influence prescribing by acting as information resources about medication, providing feedback about the quality of prescribing, and developing prescribing protocols through the formulary system. Transcribing is the process by which a prescriber's written order is copied and either manually or electronically entered into pharmacy records. The transcribing process represents an opportunity for error, especially when done manually. Pharmacists understand potential breakdowns in the transcribing process and help find ways to minimize errors. In time, the problem of manual transcribing will diminish because of the movement toward computerized prescribing order entry. However, that time is not here yet because manual prescribing of written orders is still the most common. Dispensing is the act of physically transcribing the drug product following review and approval of the prescribing to the area responsible for the administrating the medication to the patient. Dispensing is also an area where medication errors can occur, including but not limited to wrong drug, wrong dose, or wrong dosage form errors. Administration. Medication administration to the patient in hospital is typically managed by nurses. This phase of medication use process is the last step before patients are given their medications, and errors at this point cannot be corrected. Errors in the administration phase have been reported as being upward of 34%. Nurses usually serve as the final check in the medication use process. Pharmacists help improve the safety of medication administration by clearly labeling medications, using barcoding system and unit dose packaging, reduce the time and effort involved in accessing drug, and using technology that reduce administration errors. Monitoring the patient's response to the medication is a critical phase. Here, pharmacists play a vital role. Monitoring including reviewing laboratory values that are correlated with the expected medication therapy outcomes, as well as other objectives and subjective factors that indicate whether the therapy is effective or may be having a toxic effect. There are several key individuals or components in hospital pharmacy services. The first, of course, is pharmacist. Pharmacists can play a number of different roles in hospital. The traditional role is dispensing. They are responsible for preparation of medications, either directly or through supervising the preparatory work of pharmacy technicians. Dispensing pharmacists play an important role in verifying that medications are prepared correctly and are dispensed accurately. Because of the increasing use of technicians, coupled with greater use of automation and technology, and more dosage form being commercially available, positions for dispensing pharmacists are declining in some institutions. Although the dispensing pharmacist is less common in advanced systems like in the US, pharmacists' oversight over the dispensing and the preparation process remain critical. Fortunately, pharmacist education is preparing new pharmacy graduates to fulfill both dispensing and non-dispensing roles. Clinical pharmacy practice is another role for pharmacists. Clinical pharmacists are likely to serve on interdisciplinary patient care teams and interact directly with patients. Clinical pharmacists usually have a clinical pharmacy training and often have completed a pharmacy residency. Clinical pharmacists may be generalists and provide clinical pharmacy services to a wide range of patients, or they may be specialists who have a defined expertise in one or more areas, for example, critical care or oncology. The prevalence of this clinical pharmacy role continues to increase, and this trend will likely continue. The most prevalent role in institutional practice is one where the pharmacist has both dispensing and clinical roles, usually referred to as an integrated practice. This type of roles may involve the pharmacist spending a designated amount of time in each area. For example, 1 month dispensing, alternating with a month of clinical practice. Or time spent in a given day, for example, morning spent in patient care area rounding and provide order review followed by afternoon in the pharmacy verifying technician preparation medications. For the most part, these pharmacists are considered generalists in both dispensing and clinical activities. Pharmacists in management usually serve as supervisor for pharmacy activity or as director for the pharmacy department. These roles require an understanding of the practice of pharmacy and how medications are used, a good knowledge of regulations and the laws that govern pharmacy practice, and a basic skill in human resources management, leadership, budget management, and ensure quality of medication use. Good managers are especially important since the effectiveness of pharmacy services often depend on how well pharmacy managers are able to manage and lead the department. Other pharmacists' roles are evolving. Examples include pharmacists who are responsible for informatics, investigational drug services, research, sterile compounding, and emergency care. Pharmacy technicians continue to play an expanding role in virtually all practice models. Technicians has been integral in the purchasing, stocking, preparation, and compounding of medications. These have been and continue to be under the direct supervision of the pharmacist. The scope of this role varies depending on the experience, training, and skills of the pharmacy technician. The scope and the responsibility often varies because technicians do not have consistent and standardized training requirements. Because technicians play an increasing important role in drug preparation and dispensing, technician training standards are being established. This will allow greater responsibility to be transferred to pharmacy technicians, since each will meet a defined training and certification standard. Pharmacy technicians are also taking on new and expanding roles beyond preparation and dispensing. Some technicians are assuming roles that involve the maintenance of automatic dispensing technology and other information technology systems. Others are assuming roles that assist clinical pharmacists in the collection of laboratory value and other clinical data. In some organizations, pharmacy technicians are interviewing patients and reconciling medication regimens at home with those orders during their hospital stay. Regardless of whether technicians are in traditional education preparation role or in one of these new capacities, their importance is freeing the pharmacist for more direct patient care responsibility is increasing. And so is the need for training and certification. Let's talk about another key component, the importance of automation and technology. Automation and technology have been used in pharmacy since 1990s, but are becoming increasingly used in hospitals. Pharmacist automation serves to increase efficiency and the accuracy of dispensing. Medication-related technology used outside the pharmacy is usually focused on safety. For example, barcoded medication administration, smart pumps, computerized prescriber order entry. Pharmacy automation is important to the practice model because utilization of many of the available technologies can influence what the pharmacists and the pharmacy technicians do in support of medication dispensing. Full use of automation can redirect step time away from routine technical tasks and towards more direct patient care activities. The most common type of pharmacy automation is the automatic dispensing cabinet. As you know, some famous brands like Pharmacist, Omnicell. These cabinet-based technologies are usually located strategically in the patient care area in the contained compartment where individual medications are stored. The compartment only opens and gives access to the medication when the user is authorized to do so. Usually, its authorization is based on the computer in the cabinet, verifying that the medication has been approved through an interface with the pharmacy computer system. This system has been successful because they place medications much closer to the user, but still allow electronic verification that the medication and the dose is correct for the patient. They also simplify billing and the documentation of medication administration. The second most common type of pharmacy automation is the pharmacy robot. For example, McKesson robot. This system contains hundreds of barcoded packages placed in designated spaces on long rows. The robot moves to the designated space, verify that it is the correct medication using the barcode, and removes the numbers of doses needed. The robot is usually used to prepare a 24-hour supply of oral and prepackaged injectable medications. Pharmacist and technician time needed to prepare and check this medication is greatly reduced when this technology is used. Automation used in stereo compounding range from small pumps used to fill syringes and prepare parenteral nutrition solutions to large systems with robot arms capable of preparing all types of sterile IV solutions and infusions. These systems improve the efficiency of sterile product preparation while improving the accuracy of the preparation and the minimization of potential contamination. There are a number of medication-related technologies that are used outside the pharmacy to improve safety. This system have a direct impact on patients and require active involvement by the pharmacy in making sure that systems are designed and used optimally to realize their safety benefit. Examples include barcoded medication administration, that is BCMA system, requiring pharmacy involvement in assuring that drug packages has appropriate, readable barcode, and that information systems capture and document information. Computerized Prescriber Order Entry System, CPOE, require an interface or integration with pharmacy information systems so that medication ordering information is able to transfer between the prescriber and the pharmacy. Standard order set and the verification mechanism also require pharmacy involvement for this system. Smart pumps are programmable pumps that allow the user to predefine minima and maximum rate of administration. Pharmacy play an important role in making sure that the limit contained in the drug library are clinically appropriate administration, preventing errors when patients are under or overdosed with medication.